My guest today on Macomb on the Move is Dr. Rick Iverson, board chair at McDonough District Hospital. How are you today?
I'm good.
You're back from your RV travels.
Temporarily.
I have to start with my Rick Iverson story. You were my doctor for how many years, you suppose, 20?
Probably.
As long as you were here, I guess. Or as long as you were practicing. So my last visit with you, we're kind of winding down. And you look over at me and you go, so how'd I do? And it just popped into my mind and I said, not so good. And my doctor of all these years had this sort of pained expression on his face. And he goes, well, what do you mean? I go, well, when I met you, I didn't have love handles. I didn't have gray hair. And I could stand erect. And you laughed and I laughed, and that was the end of that. But it was a cute story because you were a great doctor. And I appreciate all you did for me.
The fountain of youth has eluded me.
Yeah. Hey, talk about the RV a little bit, about why you got this RV and you're traveling around, and don't you just go stay in people's houses?
Well, usually yes, but I was out for a walk early in this pandemic, and I had this brilliant idea. I thought, I came home and I told Monica, what we need to do is get an RV so that we can go wherever we want, including our kids. At that time, they were not sure they wanted us in their house even. And we weren't sure whether we wanted to be in their house because they live in suburban Chicago and suburban St. Louis. And Monica said, are you kidding? And I said, no, I think it's a great idea. And she, a few days later, got on the internet and started looking at small RVs. And she came back to me and said, maybe we should look at those smaller RVs and just see.
How small is it? Because it doesn't look small to me in your driveway.
Well, it's a little bigger than a standard van, but it's not that much bigger, and it's amazingly designed, very efficient.
You are serious about this COVID-19 stuff.
Don't have any choice. When
I was at your house, we were just chatting, I said, what happens if you test positive? And you told me you'd go live in the basement. And you were serious.
Oh, yeah.
And why is that? Why would you go live in the basement for 14 days?
Well, that would be the only way I could prevent Monica from getting it. If we could, we'd have to be very, very strict about it. She would obviously be willing to provide food for me, and we've got a big freezer in the basement with a lot of frozen meals, but the microwave is on the main floor, so I'd have to ask her to fix my microwave.
Could you come out and go take a walk around the neighborhood and stuff as long as you didn't see her?
Yes.
Okay.
Yeah, I would. That would have been a necessity to do, but we could do it without my interacting with her, getting out of the basement and outside.
So I'm going to ask you the same thing that I've asked Brian Dietz and Ed Card and Jack McPherson and Wanda Foster. Masks, and we got to have these when we're close to each other. We both got them here, and we've got to keep the social distancing, and we got to wash our hands. Correct?
Yes, it sounds too simple, but I really believe that's what would prevent us from having to shut down again. I told you earlier, in the last week's issue of the Journal of the American Medical Association, there's an article said, universal masking to prevent SARS-CoV transmission, the time is now. And it talked about the largest health care system in the state of Massachusetts with 75,000 members. And these were all healthcare workers. And when they instituted wearing of masks, their infection rate within 2 months was cut down in half. Another part of that, which actually probably was more significant to me, because around our neighborhood the talk has been, can I go to the hairdressers or not? And a lady in Springfield, Massachusetts, Missouri, excuse me, they studied 139 consecutive of her clients that came through. She wore a mask all the time. 80% of the people that came to see her wore a mask all the time that they were there. And there was not one incidence of COVID transmission. Now, maybe there wasn't any in the community at that time, but I really do think, even though it's technically listed by the CDC as a higher risk kind of thing, that it done properly, proper spacing, wearing a mask of both the hairdresser and the client, that it does minimize the risk of transmission.
You'll go out to a restaurant, correct?
Yes, I say that with some reservation because we're most comfortable eating outside, and we've done that quite a bit here in town. We have attended one restaurant in town because we really felt that we could socially distance in there. There were high backs on our seats.
Yeah.
And there weren't that many people in the restaurant at the time, and everybody that was serving had masks on. And so we will be going there again within the next couple of weeks. And we'll continue to do that because I think my main job is to do the sensible things, but figure out how to live with this awful situation with the coronavirus. I never would have guessed we would have had to do everything that we've had to do because it's been so bizarre. But nevertheless, that's what I've got to do.
You miss your kids and grandkids?
Oh, well, that was a major motivation for our getting the RV because we didn't even feel comfortable going to see them or them coming to see us. The first time we saw our one son's family, they came, they stayed for about 6 hours. We were in the backyard the whole time, socially distanced. We, at their request, had done a massive job of cleaning in one bathroom on the main floor of the house so that they could use the bathroom while they were there. I think we roasted hot dogs that particular day in the backyard. But that was our first encounter with the kids, and it was wonderful. But we did all of those things because that's what we felt like we had to do it safely.
Will you die from what was in the hot dogs?
Well, actually, probably more likely that than COVID.
These are a pain.
Oh.
I don't like them.
I don't either.
But I am resigned to wearing them everywhere I go. And when I walk every day, I have one in my pocket in the event. I think I learned this from you. In the event that I see someone that I'm going to engage in conversation. Oh, yeah. So I don't go anywhere without it. On occasion, I have gotten to the front door of Hy-Vee. At 7 o'clock in the morning, I'm first in line, and I go, oh, I don't have my mask. And instead of going in, I go back to the car, and I get my mask, because it's what we have to do.
Yes, I agree. And I don't like wearing it at all. But as I look at it, it's really a pretty small thing. You know, my dad was in the South Pacific for 44 months during World War II. And compared to what he did, this is nothing.
And if he was there for 44 months in World War II, he was there for some very bad stuff.
Oh. You know, he never would talk about it when he came home. It wasn't until my son, who was going to be a history teacher, he one day sat down with my dad, and I found out more in that session than I'd learned in the previous 30 years.
But it's a small price to pay. So let me ask you this question. We're going to wear the mask. Why do we see people on Facebook who are getting together and they get their arms around one another, and there's 5 or 10 people, and they're outside some bar and they're not wearing the mask?
Well,
they're nice people.
Yeah, I'm puzzled by that. I have to believe that too many people are not taking this seriously. Unfortunately, if you look at McDonough County's statistics, the 20-year-old decade have 2 to 3 times the positive COVID rate as the other age groups. And the only thing I can conclude from that is when I see on television and see locally people gathering in large numbers without masks or social distancing, young people predominate, which is not terribly surprising because they're kind of bulletproof at that age. You know, nothing bad can help it.
So when they get it, by and large, they go home and they're sick for a couple of days and they come out of it.
Right. They aren't, by and large, they don't get very sick with it.
But what about, so they come, but I run into them, I run into them on the street, or I somehow have an engagement with one of them, I'm going to get sick. Fatally, quite possibly.
Yes. It's very serious. And, you know, the main reason I wear a mask, other than the fact that I'm supposed to, is to protect other people from me. Because I could very well be sick for 2 to 5 days. I mean, have the virus within me for 2 to 5 days and not be sick. And so that's a primary of when the virus spreads.
But if we get it, and I was either talking to Ed Carter or Brian Dietz, and I was saying, hey, I'm 74, I got some, Dr. Iverson said I had some bronchial issues, I've had cancer. I go, am I at risk? And it was either Dietz or Carter looked at me and they went, well, the only thing you could do to be more vulnerable is to put on a lot of weight and get diabetes. Then you'd have the trifecta, you'd have it all. So he says, yeah, you've got to be careful, which I have a hard time doing because I feel young and vibrant and I'm not gonna, this isn't gonna bother me, but it is if I get it.
Well, I worry not only for myself, but for my wife, because she has to take some medication that reduces her immune system. And I'm fortunate that I don't have that, but I also don't want anything to happen to her.
Well, it's scary that people won't pay attention. And part of the reason we're doing this series of interviews with hospital folks is to try and get the word out to the community that this is serious business, that we need to wear the mask, we need to social distance, we need to wash our hands. And again, it's a small price to pay to be able to live in this country and live the lives that we live. And we're not on the front lines in Europe and Normandy and so forth in World War II, so we're pretty fortunate. You are head of the board of directors. It's the head man at the hospital, the board of directors.
Yeah, I guess that's good.
The title is what? You're the board chair. It's a cute story. How'd you get stuck with that? And by the way, I hear nothing but rave reviews about Rick Iverson. He goes to all the meetings. He's always there. He's always supportive. He's always got a kind word. So the word is good on the street for you. But why'd you get involved with this?
Actually, back in 2010, Jerome Anderson was on the hospital board. He's a pathologist at the hospital. And he became an employee of the hospital. And there's a prohibition for the hospital employees being on the hospital board. And so he asked me if I would consider doing it. And I said, well, yeah, sure. Because the hospital's important to me. Macomb is my home, and McDonough District Hospital is my hospital, and I care about it. So I said, sure, I'd be glad to. And then I got appointed by the hospital board, by the county board. And so I started in 2011. And then after I was reappointed at the beginning of 2018, got elected chair. And Ken Slater had asked me ahead of time if I would be willing to do that. So I said, sure. And the next month, our administrator resigned. And I said, gosh, this is an important thing. I wonder who's responsible for coordinating the effort to get a new CEO. And so I got out the bylaws, and I realized that it was me. That was in charge of that, which scared the dickens out of me, because I'd never done that. Didn't know one thing about how to recruit a hospital CEO. And I quickly learned that's a time when you need to rely on the people around you that know more than you do. And so we did some interviewing of recruiting firms and chose a recruiting firm that is rated the #1 recruiting firm in the country. And I said, gosh, we've got just a month until the CEO is gone, and so we're probably going to have to get an interim CEO first. And so we interviewed, we got resumes from a bunch of potential candidates, and we interviewed 3 people, and Brian happened to be one of them. And he convinced us that he was the right person, so we hired him as an interim. But he made it clear when he came that this is an interim situation, and he was not here for the long haul.
Why is he still here?
Well,
it's a cute story.
It's a good question.
And we're glad that he's still here.
And people kept telling me early on, why don't you hire him? Because they were impressed with what he was doing and how he was doing it and so on. And I said, well, he has said this is an interim situation, so we need to get the process going for getting long-term CEO. And I dutifully relayed that information anytime I was asked that. And after one board meeting, Brian said, I want to talk to you. And he said, I really like Macomb and I really like McDonough District, and if the board wanted me to, I would be willing to stay here, which blew me away. And I was a little embarrassed because I had said so many times, well, Brian doesn't want to stay. And obviously I was wrong. And so we took several months really to think that over because we thought, well, what is the community going to think if we don't interview other people? But we realized at that point that we'd had 6 or 8 months of a trial run on a guy that we were very pleased with, and there was no way you could have a level playing field. You bring somebody in for maybe 2 days to interview, compared with a 6 or 8 month actual performance, it just wasn't a level playing field. And so we finally decided that Brian was the right person, and we all felt good about it, and it was very well received by the whole board.
Well, without getting too political, I could look over my shoulder at Western and say they had an opportunity with Abraham, but I won't go any further there.
Well, I felt bad for the Board of Trustees with the dilemma, because having gone through it very recently, yeah. It's a hard place to be in.
Yeah, absolutely. So you're a young man growing up in Minnesota?
Yeah, sure, you betcha.
And you're taking the RV there?
Yes.
Over Labor Day?
In 2 weeks.
And talk about, but you're going to be very careful about who you see. You're not going to go see 50 people. You're going to go a very select list.
Well, no, normally we see a dozen people when we go back there, but we're only going to see 5 this time. My wife's cousin, 2 of her, one of her cousins who was married to a high school classmate that we're very close to, and they visited Macomb, and so we're going to visit them. They're on a farm in northern Minnesota, but we probably won't even go in their house. And then we're going to spend a couple days with my brother and his wife, but we're going to stay in the RV in their driveway. And I talked to my sister-in-law last night, and she's got it all set up in their porch so that we can stay socially distanced and talk to each other and eat together without really being in the house.
So after, what did you do in high school? Did you do anything in high school? Any sports or activities or anything? Well, I loved sports when I was a kid. I played baseball and neighborhood football and neighborhood hockey and so on. But there were 750 people in my 7th grade class, and so you had to be a pretty good athlete to make the teams by that point, and I didn't consider myself that much of an athlete at that point. Story of my life. Thank you. Cut from 4 sports in high school in a single year. Can't do it, but I did it.
But when I was a sophomore in high school, my neighbor, who was also my history teacher and the assistant track and cross-country coach, said, "Would you manage the track team for us?" And after finding out what that involved, I said, "Yeah, that'd be kind of fun," because I'm a kind of a obsessive, compulsive, organized type person, and it was giving out uniforms and collecting them and making sure they got washed and all the details that go with that. And our track team won the state championship that year, and that was really a lot of fun. Well, after the season, the head coach and assistant coach came across the street to my house and said, "Why don't you go out for cross country?" And I thought I was going to die when I was in 8th grade running runs around the track. And I knew how long they had to run for cross country, and I thought, well, I'd never be able to do it. They said, "Well, we'll have some of the older guys run with you and show you how to do it." And by the end of the summer, I was able to run around 3 of the Minneapolis lakes without stopping, which was 11 miles. I thought, well, I guess I can do this. And so I was in cross country for my junior and senior year, and that was the extent of my high school athletics.
Did you get sick? Was it your senior year?
Right after cross country, yes, I started having a pain in my belly, and I thought my frame of reference was you were supposed to ignore pain, which was kind of dumb, but that's what I thought real men did. And the third day I passed out in my second period English class, and they insisted that I go home. And my parents took me to the doctor, and it turned out I had a belly full of pus and had a ruptured appendix.
Belly full of pus is the way you wrote something, and I read that. And that's what got you thinking about medicine, right?
Yeah, before that I was going to be a dentist.
So off to college and with a medical bent, but you also had some religion in your background.
Yeah, I had originally, when I applied to the University of Minnesota, put myself down as a pre-dental person because you applied, fall of your senior year. But then with my hospital experience, changed my mind. So they had given me the dean of the dental school as my advisor. And fortunately, he was okay with my change in plans. So I was pre-med as a undergraduate and then entered the University of Minnesota Medical School. And the rest is history, I guess.
Well, so then you were after you graduated and did all your work before you were ready to practice, you took a year off to do an internship or a fellowship that had a religious bent to it.
Well, I was frustrated in medical school with the fact that I thought giving bad news to people and dealing with death and dying and telling people they had cancer and so on, I thought was kind of tough. And I asked my mentors at that point, well, how do you do this? How do you learn how to do this? And they said, oh, don't worry about it. When you get older, you'll know. I knew it was the wrong answer because I saw lots of older doctors that didn't seem to be comfortable with that, even with their experience. And my wife's father was killed in an accident. We were dating at the time. So I met the hospital chaplain where she was taking her nurse's training. And I shared my frustration with our lack of training in that in medical school. And he said, oh, we trained. First of all, in medical school, they said you can't teach that. Well, I wondered about that. And talking with the chaplain, he said, oh, yeah, we teach that to seminary students all the time. And he said, why don't you join our program for 3 months? And we had a 3-month elective in the senior year of medical school. And I said, well, I see one problem with that. I'm not a seminary student. I said, well, we can work with that, but you have to agree to be a chaplain and not a medical student during that 3 months. And so I did.
How tough was that?
That was very tough. In fact, it was in my hometown hospital, and so I encountered people that I knew and knew me. And so that was a little tricky to navigate those waters at that time, but it was a tremendous experience. I was scared to death to start with. I thought, I don't know anything, and they're going to know that as soon as I walk in the room. And he said, you know, you're not in the room by yourself when you're there. And you'll get the help you need, and you care about people, and that's going to show through when you interact with them.
Did you meet any characters in medical school that you developed a long-term relationship with? Who came to Macomb?
Well, I met Jack McPherson and Ed Baker in residency training, and I was very impressed with Jack McPherson.
That would be the BM group?
Yes.
BM group of family practice. So there's only one reason that they got you here. What was that?
I had to rescue them.
Why did you have, what was the rescuing?
Well, the BM group became IBM.
Much better, much more viable, and their business picked up tremendously.
Well, I think we were a good partnership. I had great respect for them. I saw how Jack chose Macomb as a place to come. He's a very thorough guy who doesn't do anything halfway. And he looked at probably 20 opportunities in the state of Illinois. He and Ed had decided they were going to go into practice somewhere in Illinois because they were both from Illinois. And Macomb came out on top of that. And so in the fall of 1975, Jack said, well, why don't you come with us when we go visit Macomb? And I said, well, I'm going back to Minnesota to practice. And he said, well, what have you got to lose? We'll drive, we'll pay for the gas, we'll pay for the motel. So what have you got to lose? So when we came, the steel shell of the Health Services Building 1 was up, and so I realized they were serious about wanting doctors here. But I was kind of chicken because I'd never lived in a town this size. And finally, and plus I had entered the residency out of the Air Force, and so I was out of sequence a little bit, so I had a few more months to go in the residency when they finished. And so I kind of agonized over it, and Monica and I visited Macomb a couple times, and we made the final decision to come to Macomb, sitting in the coffee shop downtown that's now the Sullivan Taylor's coffee house.
Cute story.
But we were only going to stay 5 years.
5 years? Well, you made it. You made it. You talk about knowing this place was going to, they were looking serious about doctors. I think about our youngest, Ryan, who, when he was 25 years old, I think, had what may have been his last visit with Dr. Lynn, who said, Ryan, I'm a pediatrician taking care of the young guys. Here's Ryan, 25 years old. It's maybe time for you to find somebody else. And Dr. Lynn was a wonderful doctor, a great guy. He and Grace are still in town, are they not?
I'm sorry?
He and Grace are still in town.
Yes.
Yeah, I think so. So how many years with IBM?
24 at family practice.
Started in 76? So.
Started 77 and retired from that in 2001.
Why?
A number.
I needed you.
Yeah, I know. I disappointed a few people. We were doing OB, and when at that point, when somebody went in the hospital, we took care of them in the hospital as well, which meant that it wasn't too unusual to be up all night and have to work the next day, and I was running out of gas as far as energy was concerned. I just was worried that I was going to be, that at times I was so tired that I wondered actually if I got called out at night, would I be able to get up and go? Would I be motivated to do the right thing? And I don't think I ever didn't do that, but I was so tired at the time that it became a worry for me that I would do things I shouldn't. And,
you also had to read that stuff like that every month, right?
Well, yes.
I mean, Jack McPherson mentioned that. He said, I was tired of having to keep up.
Oh, it is, there's a heavy burden. There's a lot of, because that comes weekly. I have another journal that I read all the time that comes every other week. And then that much more that would come in that you had to stay up with. But anyway, at the same time, my second son decided he wanted to go into college student personnel and dealing with the non-academic side of college life. And I'd never thought about that. And so we had breakfast weekly while he was here in grad school. And I thought, I am who I decided to be when I was that age. And I had lots of good mentors and people who saw things in me that I didn't see in me at that time and kind of pushed me in the right direction. And I thought that might be a good way to end my career. And at the time, they needed somebody at the health center at Western. And several of my physician friends and the director of the health service at the time asked me to come take a look.
So who hired you? Dexter? Was he there?
Well, Dexter was there. He was one of them that was working on me to get me to come over there. But Pat Sartori was the director at that time. And,
yes. Pat and Mike.
So I took a look at it and I said my famous last words, I'll come, but only for 5 years.
How many years there?
14.
Really? That many years?
Yeah.
Wow. And then did Ed go there?
Yeah. Ed and Jack both came over there.
And then you end up giving the guy who succeeds you, Muddy Waters, takes over. He's still there, Mike Waters.
That's right.
Hey, so talk about Scott just for a minute. So where is he? What school?
He's at Purdue Northwest.
Have they started classes?
Their students are coming in now. They must be starting in the next week or so.
Has he got any stories yet?
Oh, he has more stories than I ever had.
How's it going with these kids coming back with COVID and all that?
Well, he's already had some significant difficulties with some of the teams congregating and not socially distancing and with masks and so on. And their school has decided to be pretty tough with people that don't follow the rules, so to speak. And so Scott, part of college student personnel training is in the legal aspects of, how do you treat students? What can you do and what can't you do and that kind of thing. And so just like Western, they have a very well-developed disciplinary system. So when people break the rules, for most things, there isn't an automatic, dismissal from school. There's a process that you go through. So Scott's in the middle of that with the people that are not following the policy, but they're moving in. I think they started moving in this past weekend, if I'm not mistaken, from what Scott said.
It's hard. I feel bad for these college students today. It's a very different world than we experienced. It's just so different. And you can't congregate. They have to wear a mask. They have to get their food and take it back to their room. All those things. But having said that, if they're going to go, they're going to have to abide by these rules. And I think Mitch Daniels, who's the president of Purdue, they had 36 kids they sent home last week. And they said, if you're not going to abide, you're going to have to leave. And I'm sure Martin Abrahams and his team at Western are thinking the same way, that if these kids congregate like they shouldn't, they'll have to leave, which is going to be tough.
Yeah. Well, I think Mitch Daniels has been a leader in the country saying, we need to go back to school, but we need to do it right.
How do you feel about young folks going back to school?
It's interesting. All three of our kids' families have a different situation. Our son Scott in Munster, Indiana, they've been back for 10 days already, and in person. Each of them carries around a plastic shield that when they sit in their desk, they put it down on their desk so they have some protection from other students and so on. But it's going great. Our junior, Charlie, says he eats his lunch in the gymnasium because there isn't enough room in the cafeteria to fit everybody in. Sure. So half of them have to eat in the gymnasium, and they said there's a desk in there, and he feels safe, and they have some ability to relate to each other. I mean, they can't congregate in small groups, but they could have 2 or 3 socially distanced around them. Dan is the union representative of the teachers in Naperville, and they are starting the 1st of September, and all online, distant, for 6 weeks, and then reevaluate, and then they will decide what to do at that time.
That's a big school. He's at Naperville what? Is he at Naperville North or Central? Or?
He's at Naperville. Well, he was at Naperville North, but now he's over all the teachers in Naperville.
Oh, really? Well, good for him. Is he still coaching track?
Yes.
Oh, good, because he's a tremendous track coach. Tremendous track coach.
Well, he's had
some great success.
It's a good success, yes. And then Nicole, we're going to visit her on Wednesday. She is also a track coach, and she's a school nurse. And so she is getting geared up for that, and I think they start next week, if I'm not mistaken, but it might be the 1st of September. But they're going back in person, I believe.
So IBM to Butte, and then when do you leave Butte?
2015.
And then what do you do? Sit home a little bit?
Well, I did a little thumb twiddling, but that wasn't too satisfactory. So I volunteered at our church as an administrator for 3 years because I really felt over the years that all the time that pastors spent worrying about the lights or the toilet, they weren't being able to be spiritual leaders for the congregation. And I'd learned a few things about administration in practice, and especially over at Butte.
So were you a volunteer employee at Wesley?
Oh, yeah. Yeah. And I being paid would have been too complicated at that point. And it was really, really...
Yeah, it would have been, wouldn't it? Yeah.
It was really satisfying, and I learned a lot of...
Labor of
I
love.
learned a few new computer skills, which I desperately need. I'm very poor on the computer.
Did you get to figure out how to use a mop at all or anything like that?
No, I didn't get into that. I did do some supervising of the mop handler, though.
Oh, the mop. So, all right. So then you get on this board, and what does the chairman of the board do?
Well, I guess the best answer is whatever the board, the rest of the board, and the CEO thinks he needs to do.
How many people on the board?
There are 9 of us. And we've got an excellent board right now.
Wasn't that you mentioned earlier they didn't want to have a doctor on the board, which seems counterintuitive because there have to be questions that are brought up at the meeting that require the input from a doctor,
right?
A doctor's perspective.
Well, the restriction is on employed physicians. So if a physician is employed by the hospital, the tradition has been that they shouldn't be on the board, but they're also, it's recommended, or the board is very open to having medical people. So Carol Stewart, former RN, not former, she is an RN, but retired, is on the board now, and Kurt Farr, who is one of my former partners, is on the board as well. So we have, I think, excellent medical representation on the board right now. And then, of course, the medical chief of staff attends all of our main board meetings, and Ed Card is a chief medical officer at the hospital, so that there's some continuity in leadership over time. And the role of the medical chief of staff, it's unbelievable how many meetings that the medical chief of staff needs to attend on a regular basis. And so it kind of split up the workload a little bit in, I think, an appropriate fashion. Ed is an excellent CMO, and Jeff Sparks is currently our medical chief of staff, but we've had very, very excellent medical chiefs of staff on the medical staff.
So what kind of issues are you looking at? What are your contentious challenges today?
Well, obviously, we want McDonough District Hospital to be here for future generations, and that's a primary responsibility. Second, I would say, is to deliver the kind of services that people in McDonough County need. A good example of that, one of the things that Brian has accomplished since he came, we have a very, very good relationship now with the cardiologists at Blessing Hospital. And 3 of them come up here weekly now to see people. And they have greatly increased the services, cardiology services for us. here, so much so that if I have a heart issue, I'm going to Blessing for it. But they're here, and they've been just providing excellent service for us. Even people that have gone elsewhere in the past have been impressed with the service they've brought. But we're hoping to bring other specialists on board. We have a pulmonologist now that's coming regularly to McDonough District Hospital from Blessing. And so anyway, giving the right kind of services. And of course, obviously we want to maintain the facility so that what we have is as good as it should be. And one of the things I enjoy is taking medical students and residents in training around the hospital, because they usually are in awe of the kinds of services we provide and the equipment that we have, and just how we do things. Because there's a kind of a perception from the big city that if you're in a little city, how good can it be? And I had that perception when I moved here. And what I found was that our service actually was better here than it was in Rockford. Not that we had better machines or anything, but when you have a smaller operation, you can give more personalized attention. And I think people generally see that here. I certainly do.
I certainly would concur with that, yeah. Are you having any fun with that job?
It's very gratifying. And now it's simpler now that we have now that we have a CEO and have all the senior leadership positions in place. We have an excellent senior leadership team in place right now. Just fantastic, I think.
How often does the board meet?
Our official meeting is a monthly meeting, and then there's a finance committee that meets monthly as well. And then there's sometimes some ad hoc type things. If there's something that needs attention right now, we can have an emergency board meeting. But since we've got our senior leadership positions filled, that's happening less and less. So most of the time now, it's 2 meetings a month.
Looking ahead, what's on the horizon?
Well, we want to survive COVID. We've had to do some amazing things to deal with it. I was kind of blown away with what we decided to do initially, but I think we did the right thing. There's only one door you can get in the hospital now. And in order to do that, you need to go through temperature screening and questioning if you've been sick, have you had any symptoms lately. But the reason for that was to keep COVID out of the hospital. Right. Now, that doesn't mean if you're sick and sick enough from COVID that you need to be in the hospital, obviously you need to be in the hospital. But most people with COVID are not that sick. But many of them don't know that they've got it, and yet they can spread it. And so we wanted to minimize the opportunity for somebody who wasn't sick or didn't know they were sick from spreading it to people in the hospital. So we've had some pretty severe visiting restrictions that have been relaxed a little bit, but still is present. And the neat thing is, we had this, people have been by the campus know that we've got some tents up in the parking lot. And one of them is that people don't have to come in the hospital to get most of their tests. Right. Their lab tests and their tests for COVID can be done without getting out of the car even. Drive through the tent, get the test done, and go. And that has been so popular that we just authorized the building of a permanent building in the parking lot. And so we're going to continue that even after COVID, because people love not having to keep coming into the hospital, because you can come in 10 or 20 minutes, be done with your business, and be on your way. And if you have to go in the hospital, it may be a 3/4 of an hour or hour and a half procedure, and people just appreciate the convenience. I guess we shouldn't have been surprised given the lines at the drive-throughs in town.
Wow. What are the 3 W's?
Wear your mask, wash your hands and watch your distance. Keep your distance between people.
If we would just do those three things, we'd be in much better shape.
If we universally did those three things, I'm pretty sure we wouldn't have to shut down anywhere from here on.
I thought in May, mid-May, late May, that we were close, that we were all doing it as a nation, and then we had the decision that was, I guess, left to the governors to open up, and all of a sudden, Florida and Georgia and Texas and everything's opened up, and then this thing just spread like wildfire.
I kind of understand, because it's been an awful challenge to economics, and people losing their jobs and that kind of thing. But I think unless we take the appropriate precautions, we're never going to get the economy back on track. We've got to do these things and get COVID under control, and then the economy can come back. And this, I think if we do that, this recovery is going to be better than we think it might be. But we've got to COVID's got to be number one.
But at this point, as we sit here today on August 24th, it's depressing.
Yes.
Because you wake up every morning and it's Bill Murray Groundhog Day. It's the same thing. The numbers are going up, and people are just not doing what needs to be done to get the thing to go away. And it's not going to go away. It's going to always be there, but we can at least deal with it and get the vaccine, and hopefully that will help mitigate some of this.
I'm very pleased with our local response, because if I go to Hy-Vee, everybody's got a mask on, and I feel comfortable doing that. I feel very comfortable going to the restaurant, provided that we've got the distancing and we've got the masks and the employees are wearing their masks and so on. And I think we can continue to stay open if we do those things. But we have to be careful. And every time I do something a little different, like the first time we went to the restaurant and sat inside, I had to ask myself, is this okay? Am I doing what I should do? Are they doing what they should do? And I realize that I'm not going to make perfect decisions. I may regret what I did, but as long as I'm evaluating each time I do something different and say, okay, is that the way I should do it? I feel pretty good about things. I mean, I think we're probably doing what you've done. We've got hand sanitizer in all our vehicles, and first thing we do after we go in the grocery store is use the hand sanitizer. Yeah. And we've got an ironclad rule. When I go home today, first thing coming in the house, Monica's going to say, "Did you wash your hands?" So that's the first thing we do when we come in the house. But it's not that big a deal. And again, put it in perspective. This is nothing like what my parents had to go through in World War II.
It's not that big a deal, but it is a big deal. If we don't do it, or if we do it, it's important that it gets done. So you're a giver. You're very involved with Wesley and have helped them out, and with the board as chair, for heaven's sakes. But you were also involved with the school referendum here years ago. Nobody knows the story, but tell the story about you and this is how good a leader you are, Rick Iverson, because you know how to work things behind the scenes. You got this guy Jim Miner involved, because the first time when you were on the board, it didn't pass, correct?
No.
Didn't pass. How many votes were you shy? Not that many. 70 votes? Yeah.
But it was important. When I first got on the school board back in the 80s, the first thing I found out was that we were going to be short $750,000 in the budget for the next year, and I think it was about a $6 million budget at that time. And how are we going to do that? And the choices that we had were pretty awful, between bad and even worse. And so anyway, I was asked to head up an effort to get a referendum passed. And first thing any leader learns is you can't do it all yourself. You got to have the right people with you. And we recruited a fantastic group of people that all had a job to do, and they all did their jobs well. But I came to see Jim Miner had a critical element that every group like that needs, and it's a person with enough energy directed in the right direction. And Jim was that person for us, because we met often, and it was easy to get discouraged, having been defeated once, thinking, well, are we fighting a losing battle? And Jim was there to cheer us up all the time, and they keep on going. And Jim's a great person that way, and we did it. And we needed it at that time. I think in Illinois, property tax has too much to do with how much money a given school district has. It's very unfair. It's unfair to the farmers. It's unfair to a lot of people. And there ought to be a different way to finance things. I'm not an expert in that, but I know that the property tax thing is really a big deal. And I think property tax that we pay are higher than they should be. I mean, I don't resent having to pay that, but it is a real burden for a lot of people.
What is the biggest change you see that's happened in medicine since you got started? And I think we talked and you said something about Medicare. How has Medicare changed the playing field?
Well, Medicare, when it was first instituted, had a major flaw, which it wasn't recognized as a major flaw at that time. They said, tell us how much you spend to take care of people. This is when they're talking to the hospital, and then we'll reimburse you based on how much you had to spend to take care of people. Well, the problem was that there was incentive to do more and more and more. The more you did, the more you got. And it was pretty obvious very quickly that that couldn't be sustained. There is a limit to things, and we were doing things that were, on the surface of it, good things, and yet we couldn't afford to do them. When Bruce Borum, who was a physician here when I came to town, when he was getting ready to retire, I said, Bruce, tell me, what do you see as the major challenge facing medicine right now? He said, oh, that's easy. We can do more than we can afford, which was, in a nutshell, I think, the crux of things. But anyway, in the 80s, the government recognized that and said, okay, we're going to change the way we reimburse you. First of all, we're going to tell you if somebody comes in with pneumonia, this is how much you're going to get, whether they're in for 2 days or 2 weeks or 2 months. This is what you're going to get. That was the first attempt to get things under control, which was really a challenge because obviously not everybody is the same.
Right.
And so now the situation is pretty much turned completely 180 degrees around. We are given a certain amount of money, and that's it. You have to justify what you do. And furthermore, since the Affordable Care Act, there's been a tax so that they withhold, I forgot if it's 1 or 2% of what we normally would get, and that goes in a pot, and then you have to meet certain milestones in order to get that back. And of course, it's such that very rarely can you get all that back because it's not possible to meet all the requirements that are there. So the funding has changed drastically in how things are, and so we have to do things differently than we did. One of the purposes of the Affordable Care Act was to put the emphasis on quality more than quantity. So are you doing a test that is necessary or not? Or is this just something extra that you really don't need to do? And so we've had to make pretty hard decisions on things and decide where do we put our emphasis and how do we take care of people given the fact that we have more severe constraints on how we're going to get reimbursed.
What's the future of medicine?
Well, it's ever changing. And I think that's probably the biggest lesson I've learned in the last 9 years, is that what was good and what was successful last year may have nothing to do with success this year. The COVID thing is a fantastic example, because we had to completely look at everything, given the fact that 83% of our income comes from outpatient procedures, lab work, surgery, that kind of thing. And that virtually disappeared when COVID happened. In fact, it was mandated that we could not do elective surgery for a period of a couple months. And so that meant our income plummeted.
And here we probably could have continued to do surgery. I mean, we weren't, it hadn't arrived here yet.
No, but the reason that was shut down was surgery uses personal protective equipment. You know, you wear the gowns and the masks and the gloves,
Sure.
and so on in surgery. And if you're doing a normal amount of surgery, are you going to have enough if you have an influx of COVID people? And a lot of our personal protective equipment was coming from countries around the world, a big one being China. And the supply wasn't adequate to the demand. And so that took some time to get remedied. We've been very, very fortunate here because we're in good shape with the personal protective equipment and so on.
The numbers were sky high when this first started in New York. How did they get it under control?
Well, the 3 W's, and then the shutdown of everything, basically, except for essential services. And I think they were poster child for how to do things effectively, because they did shut it down. And I think they still have one of the best percentages as far as positive tests, the number of tests that they do and the number of positives. Last I saw was about 1 or 2% for New York.
Wow.
And that's very, very good. But they're having things even in the 20% range in some of the places, Arizona and Texas and so on, at this point, which is really discouraging.
Again, because they're not doing this.
Right? You know, it's, again, I say, what will do the trick for us is not that complicated. Yes, it's a challenge. I hate the fact that the main thing I have to do when I leave the house in the morning is to make sure I've got my mask in my pocket or my mask in the car.
Yeah.
And I've had, I'm sure you have too, have turned the car around and go back because you forgot to put it in the car that...
I was pulling out of the driveway this morning, and Diane opened the door and she goes, "Here it is, you forgot it." And I go, "Oh, thank you." Right, I had to go home and get it. Yeah,
So,
yeah.
But when you look at it, as I say, compared to what our parents had to do in the Depression, what they had to do for World War II, the Korean War, Vietnam, this is nothing.
Right.
And if this is the worst thing that I ever have to deal with, no big deal.
But so the future is bright for MDH?
I think it is. Prior to, we had 3 years of losses at the hospital prior to this past year, and we were on track to just about break even this past year, and then COVID hit, and that put us in a big hole, although the government has been very good to us in terms of reimbursing us. The only problem is they haven't told us how much of it we're going to be able to keep. They just said, "Here, put this in, but don't spend it."
Oh.
And well, they didn't say don't spend it, but they also said we may ask you to pay it back, so we've decided that we better not spend it.
I assume you're very proud, as you mentioned earlier, of this team that you and Brian have put together in terms of your top leadership at that hospital. Every time I hear about any of these people's names, Sparks, McGregor, Card, you, McPherson, Dietz, Foster. I hear rave reviews.
Oh, I couldn't be more proud of the people that we have and the effort that they put in. You know, we when this hit back in March, we were having to start with a couple times a day meetings about, are we doing the right things? What do we need to do? What do we need to look into? What aren't we doing that we should be doing? And then that gradually decreased. And up until about a month ago, it was weekly that we were having these meetings, and the appropriate people, different areas of the hospital would come together and share. We'd find out how many gloves we had, how many masks, how many personal protective equipment, the gowns, and so on. So we made sure that everything was being done that should be being done. Edgar Rodriguez has been really, really helpful in this whole thing from the county, and helping us to navigate through this with the appropriate governmental agencies and so on. And Adrian McGregor has had very, very frequent contacts with Representative LaHood and Senator Durbin and governor's office and so on to make sure we were up to date on what needed to be done, what was being recommended to be done, and what was in the future that we could look forward to.
So you're very positive. Is it Adrian McGregor, who also works with the representatives and so forth?
Well, part of his role in this whole thing has been to maximize our contact with the legislative and governmental people, and then also the nursing homes, because as hard as it's been for the hospital, I really, really feel for the nursing homes because their job has been so difficult. The isolation that they've had to impose on their residents has been awful for them. You know, imagine, having your mother in a nursing home and you can't go see them, even if they're sick and dying.
And the clock's ticking. You're getting older, and yeah.
It's terrible. Monica's mother lives in a senior living center in Oregon. And so we've read almost daily reports on the kind of restrictions she's had to go through. She's restricted to her apartment in the building most of the time, but she's not been sick. But like if you go out to the doctor, you got to self-quarantine for 14 days.
But we can get through this thing if we just stay the course and do what we're supposed to do.
That's one thing I think the people in the nursing homes could teach us, because this is nothing compared to what they've been through. And yes, we can get through it. We just got to do our part.
So you talk about your parents. What sort of life lessons did you learn from them?
Well, Dad said you get up and go to work in the morning, and no matter what. And he was a fantastic example of that. Mom was amazing. I don't think she ever found a person she couldn't find a way to love. And
never met me. You're not supposed to laugh. You're supposed to have a deadpan look like, no, Gordy, that's not the case.
So I had a fantastic upbringing. We didn't have much wealth, but we always had enough to eat, and they all encouraged me. They said, you can do this, even when I wasn't sure that I could do whatever. And we had a big extended family. Mom was one of 8 kids, and Dad was one of 7 kids, and so
oh boy,
had lots of uncles and aunts and cousins, and that was a real blessing.
What's the best advice you ever got?
Best
advice you ever got?
Boy, that's tough, because I've had so much good advice over the years.
Well, come to Macomb from Baker and McPherson, I'll say that.
I've said, I just wrote a letter over the weekend, and I said the smartest thing I ever did was to ask my wife to marry me, and the second smartest thing was when I said yes, when Jack said, why don't you come to Macomb? So that was good. And Jack and Ed both knew about the quality of life in small towns. I didn't. But small town life is the best kept secret in the country.
It is, absolutely. And we talk about this. Kids in Cleveland, Corpus Christi, and Chicago If this is happening, as bad as this is a good place to be.
Oh.
It's horrible not seeing the kids and all that, but it's good to be here. People care about you, love you, you know. You can get out and be safe, and when you're in Chicago and you go out for a walk, there's people everywhere. I mean, it's a very different environment here, very positive environment.
I agree. I am so blessed to live in Macomb.
What does Rick Iverson do for fun besides travel around the RV now?
Well, I love putzing around the yard and doing that kind of thing. I love to read, absolutely love to read. One of my problems, however, is I usually read about 6 or 8 books at a time because I get bored reading one particular thing, so I'll read a chapter and then move on to something else. So I usually have multiple books going.
You have a favorite author?
Oh, I like Bob Woodward. I've got a number of mystery authors that I enjoy.
Woodward, as in Woodward and Bernstein?
Yeah.
That Woodward, yeah.
I don't think I have just one favorite, but I love a variety of kinds of things. I really like history, and I do a lot of. I probably read more history than anything else.
Then if we locked you in, so we had to lock you in a room and it couldn't be with Monica, you'd probably pick Brian Dietz. Wouldn't we? I mean, what a guy. I mean, talk about a guy who's into history.
Yes. Yeah, Brian is a very interesting man.
But very knowledgeable about that. Hey, you got a favorite movie?
This is going to probably be a surprise. A movie called Ordinary People.
Absolutely, with
Mary Tyler Moore was in it.
Yeah, and
Donald Sutherland.
Alan Alda?
No.
Oh, what's the name of it again? Which one?
Pardon?
Ordinary People?
Yeah. It's about a young boy that tries to commit suicide,
yeah.
And the thing I like about it is that it's one of the few movies that I've ever seen that really portrays what a psychiatrist can do and a mental health professional can do, because it really does a very good job of the interaction between the boy and his counselor.
Yeah.
And mental health has been one of my real loves in practice. I don't know why, but I really have enjoyed that aspect of
Who's the male
practice.
lead in that? It's not Pacino or Hoffman. Trying to think who the male lead in that movie was. Ordinary People.
I don't remember who the boy was, but Donald Sutherland was Mary Tyler Moore's husband.
Is that
in
right?
one.
Yeah. Well, I saw he was in the Eye of the Needle, which was a great movie. He plays a German spy, and he's just so nasty, but he was perfectly cast in that movie.
One of the things I've appreciated, our theater is open now, and it's very easy to social distance in that.
Our theater here?
Yes. And
You've been there?
They've had some old movies. We went to see Back to the Future this past weekend.
Really?
Yeah. And Shrek is there now, and
you can socially distance?
Oh, yeah.
Because I'm a movie nut.
Yeah, there's plenty of room in the theater. And they do a nice job of that, but for some reason, they've brought back these old movies, but they had Jaws a week
Really?
ago. And what else did we see?
Can I buy popcorn?
Oh, yeah.
No kidding.
All the usual stuff.
Well, I'm glad you told me that.
Our theater is one of our
Now,
best
here's the
kept
challenge. Here's the challenge. For me to go home, I'm going to say, if I say I'm going to go to the movie theater, I'm going to get a no. But when I tell Diane that Rick and Monica Iverson have gone to the theater, there's a chance I might get to go.
It's. I think in the years we've been in Macomb, only one time have I been in a full theater. It's very easy to socially distance out there.
Yeah, remember when I loved it when they had the classic movies they bring.
Yeah.
Those were some great movies that you wouldn't get to see otherwise. What's your legacy going to be?
My legacy.
I got you. Besides, I got Gordy Taylor through three decades.
Well, I hope that people think of me. They think that I took them seriously when I interacted with them. I know I'm not perfect, and I did not do everything perfectly, but I really, really, really believe that it's very, very important to listen to people and hear what they're saying and what's going on with them. I met some amazing people in practice. I met some amazing students while I was at Western. Students were very inspirational. Most of them were there working hard, willing to look at changing, willing to hear how it was that successful adults manage this thing we call life. And it was just a really good experience. And it was kind of a surprise that I liked it as much as I did.
Besides your family, what are you proudest of?
Boy, that's tough.
This one's supposed to be easy. This is Mike Wallace sitting here.
The proudest thing by far is my kids and their spouses and our grandkids. It's just so much, so satisfying to see their lives unfold. And that includes the grandchildren and our kids as they learn how to be parents, and they learn how to be parents of drivers, and they learn how to be parents of kids that are dating and kids that are having the challenges in their lives. And it's just, got an amazing family that we just love watching.
Well, I hope you're proud of the great job you did you're doing serving this community in multiple ways.
I appreciate that. It's been, I can't think of a better place to have spent my adult life.
And I'm gonna give you one more chance to tell everybody what that best decision was, because we want to make sure she knows.
Well, I told her, but yes, asking my wife to marry me was by far the best and smartest thing I ever did.
Me too. Me too. No question about it. Reminds me, I've almost forgotten to ask you about this, and it's so important and it's so pivotal. It's pivotal to what Rick Iverson is all about. AOD.
Oh.
I can't believe it. I almost walked out of here without asking you about that, because you brought it here, and it's so important. Certainly important to my family. What is it? What's it all about? And how does it help people?
Well, we need another hour.
I know we do. and I know Dial back there saying his bladder won't last another hour. But give us a few minutes on that.
Well, much to my surprise, I guess I would say, I ended up with a very, very strong interest in treating drug and alcohol addiction. And that's a whole other story. But I realized that I had a completely wrong attitude about that from my medical training, as I really thought it was a hopeless problem that nobody ever got better from. And what I found was, in this day and age, there's very good treatment, and it is a very, very hopeful kind of a thing. I believe that addictions are a brain disease, and that in the non-thinking part of our brain is the key to what goes on with addictions. And it's right in the area of the brain that says, if you don't drink, you're going to get dehydrated. If you don't eat, your blood sugar is going to go nothing. If you don't breathe, you're going to die. And there's a part of our brain that if you get addicted, it's telling you, if you don't use this substance, something terrible is going to happen to you. And that's non-thinking part of the brain. It's just fascinating to me. The chemistry, the biochemistry and the physiology of addictions is absolutely fascinating.
So what do we have in Macomb now?
Well, the behavioral health at the hospital is very active in that. Both the Bridgeway and North Central here in town deal with that. There are private individuals that deal with that. And then the AOD, Alcohol and Other Drugs Center at Western, deals with that with students. And the importance of that, back in a time when we had more students, but when, say, 10,000, you can pretty much guarantee that between 1,000 and 2,000 students and 10,000 students are going to have problems at some point with alcohol or drugs.
Managing it.
And 500 to 1,000 of them will actually be on the road to addiction if there's not attention paid to it. And one of the nice things, and one of the great things about dealing with adolescents is they're a whole lot easier to deal with than fully formed adults.
Because when they become fully formed adults, they can look you right in the eye, and they've got some mechanisms that allow them to justify what they're doing, and yeah, absolutely.
And so they can change. They can at 20, they can turn on a dime and change the direction in their life. And it was really, really gratifying to see that at Western when you'd have a student coming in that was clearly going into going to have long-term problems.
And these kids are coming in, many of them have not had experience with drugs and alcohol, and here for the first time in their lives, it's readily available, and they can create patterns in their life that will be injurious to them forever.
One of our early counselors said something to me that I've never forgotten. She said, you know, when they start getting into trouble, most of them are really puzzled. Why am I having all this trouble? Not everybody else isn't having this trouble. Why am I having this problem? And they want to know, why am I having this problem? And it's wonderful to interact with them at that point, to share with them what we've learned and what we know about it. And if I'm talking with a student that may be addicted to something, there's no way I can tell for sure, do they have an addiction? They're the only ones that can make that decision at that point. So we had to give them enough information, ammo, so to speak, for them to make the right decisions about their life.
Does AA work?
Oh, it's critical. It's critical. For a long time, that was the only thing that we had that worked. In 1935, and it started with Dr. Bob and Bill W., they got together because they were dying from it. And they were unique individuals, and they said, we don't want to die from this, and we're going to fight like hell to do whatever we need to take care of ourselves. And they started something that has been amazingly successful ever since.
And you brought it here?
Well, AA was here. In fact, that was how I got into this originally, because somebody in AA said, I think Iverson would maybe listen to us. And they started sending me people. And I didn't know why they were sending them to me, but I think in retrospect, I think they were sending them to them because I was able to be non-judgmental with people about what was going on. And I learned a lot from the AA people that I had no idea. I had a lady, a businesswoman, come in one day. She set this tape down on my desk, and I looked at it, and it said, 40 minutes with a recovering alcoholic. And this was a well-dressed, very successful businesswoman. And it blew me away, because I didn't think women got that kind of problem. And then I listened to the tape, and she was telling me about hiding her alcohol in the toilet tank and in the light fixtures and all the other tricks that she had to hide her drinking from her family. And I realized that I didn't know much about this at all, and what I did know was mostly wrong. And that's when I went to Minneapolis and took a week-long course from a place called the Johnson Institute at that point to see what this was all about, and I was just blown away by what I heard there.
But people will not get help until they're ready. You can't force them.
No, although anybody that gets into treatment with some degree of coercion. And so if you get adequate time with the recovering community, regardless of how you get there, it can be successful. If you're mandated to go, by the law, you either do this or you go to jail, or if you say, if you don't do this, you're out of a job. So there's always some form of coercion that goes on with this. It may be self-coercion. A person may realize, if I don't do this, I'm going to lose my job. But the treatment has the same degree of success no matter how you get there.
Well, this ailment is real. I know it firsthand. I didn't know it when I was in college, but my mother, who was a wonderful woman, took good care of her 4 sons, but had some horrible health issues, turned to alcohol. And when I was in graduate school, my older brother found the bottles in drawers and hidden all over the house. And she died at 47. And it was awful. But we didn't know then what we know now. And this woman who was on the homecoming float, and she just had everything and lost it all because we didn't know what to do. And we didn't even know it was a problem until the very end.
That's a thing I should probably end with. Most people have a drug or alcohol addict in their life somewhere. And when they realize it and are in the situation of wondering, what can I do? Because, quite often they've talked to the person and not seem to get anywhere with them. But that's where the professionals can really be helpful. Now, what do I do now? I see a problem, but I have no idea what I could do that be helpful. Because the helpers can really be helpful with that, because it's very hard to visualize how can I intervene in this situation where other people have tried to intervene, I've tried to intervene, and nothing has been successful. And that's where the professionals can really be helpful to find out how can I be helpful in this situation. I see a problem. I don't have any idea what I can do. Talk to the professionals because they can help.
When you talk about everybody knows someone, I mean, I sit here and I've never made a secret of it. Both my parents are dead in part because of alcohol and Philip Morris Commanders and Terrytons, way too much. But I have 3 brothers who are all neat guys, all graduates of Western, and they're all dead. 70, 71, 54, and 59. And at some time in their lives, and sometime till the end, was the tremendous presence of alcohol or drugs or both. And I think about where my life would have gone had I not run into Diane Paulson at a blind date out of Lake Argonne. What would have happened? What would have happened to me? Because I would have been, I'm a product of that same family. I'm sure I would have been on the same course as they were. And I remember very clearly, maybe 15 years ago, whatever it was, sitting down with you. And we said to you, we got a kid. We don't know what we're going to do. And you said, if you don't do something, he's going to be dead. I think the final word is, it is not hopeless. As hopeless as it may seem, there is hope. I think that's the other thing that I probably got from my mother, that as I would talk with people and see what was happening, is to be able to share the idea that there is hope, and that's very necessary. We're very proud of this guy, and he's got his 10-year coin, and he speaks to groups, and he's a miracle, and he did it through the help he got with AA. But we're ever so proud of him. We're glad he did what he did, because it's important to him and to our family. But it comes back to what we talked about. I asked you a little while ago, what are you proudest of?
I guess that would be right up there.
I've got a kid who is alive because of you, and a wife that I'm with, and we're happy and content and in love because of the advice you gave us. So,
thank you.
Well, when you sit back and wonder, it's been a good journey. It continues, but you've been very, very important, very helpful to a lot of people. So to conclude on our original note, I feel it's okay. We always joke. We always joke. Used to joke years ago. Jim Miner and Kathy Onion and Gordy Taylor could get up and give these speeches all over the country, but when we get up and start talking about our families and our own personal lives and experiences, we just fall apart. And when Susie Miner passed away, and they had the golf outing in her honor, and Jim was there and had to say a few words, he was able to go for about 15 seconds, and then he was gone. And I told him, I said, that's okay, Jim. That's what we're all about. But COVID, we can deal with it if we do the right things.
Yes, we are dealing with it. I feel very, very good about what's happened in Macomb here with that. Our mayor has been right on the ball as far as making recommendations and telling us what we needed to do. And I'm very, very thankful again for being here. I don't like that we're here in this situation with COVID. I hate it. Every time I put this thing on, I don't know that I'll ever like it. But it was interesting. My first clerkship in medical school, we spent half of a day learning how to put on our personal protective equipment, to wash our hands before going into surgery, putting on their masks, on how to do that, and so on. And it made perfect sense at that time, because they said if you don't, somebody's going to get your germs and die. Well, that's still the same.
On that note, here we are. Rick Iverson, thanks so very much for taking time from your busy schedule. I guess for giving me a little self-induced therapy here, but I appreciate it. And you folk, thanks so very much for watching this edition of Macomb on the Move. Hope you enjoy it. Have a great day, and wear the mask. Take care. Thank you.